Hello, hello, hello. Welcome, welcome, welcome. Come in, come in, come in. This is Tamika Zen. I am Tamika, and this is Self Care Saturday, y'all. Okay, if this is your first time finding my channel with Self Care Saturdays, we are, you know, breathing in confidence, exhaling doubt. All right, we are trying to focus ourselves and focus on ourselves, you know what I'm saying, and concentrating on the most important thing before we go ahead into this next week. And of course, that most important thing is you. Okay, YOU. And so with Self-Care Saturdays, I usually am giving self-care tips, talking about self-love. We are bringing awareness to mental health, stopping the stigma on mental health, breaking the silence. We are talking about positive affirmations and just trying to have positive vibes. That is what it is all about, okay? And so for today's video, I am going to be focusing on PTSD because last Monday was PTSD Awareness Day, okay, June 24th, and I didn't get to talk about it, so I'm going to go ahead and talk a little bit about it now. And so, of course, first and foremost, we want to know what PTSD is. PTSD stands for post-traumatic stress disorder, right? And it is a mental health condition that is triggered by terrifying events, either by experiencing it or witnessing it, right? Now, originally, post-traumatic stress disorder was thought to be only something that military personnel and veterans went through, right? But we now understand that anyone, especially those who experience threatening events, can suffer with PTSD. That is something that I had to become aware of, all right? I definitely was one of those people that really, when I thought about PTSD, I thought about veterans, I thought about cops, even doctors, EMS, and firefighters that, would probably see some pretty horrific things on the job. And so I had got diagnosed a few years back and started to get more information on it and realized that anybody that has dealt with a traumatic experience, it makes sense when you think about it in that context, right, can suffer with PTSD. And of course, over the last 30 years, there has been a substantial increase in PTSD. I don't think anybody is shocked about that when we see everything that's going on in the world. And we know that it has been an increase in mental illness, period. We have millions of people that struggle with, substance abuse, also living with PTSD, right? And we have millions of people that suffer with PTSD, period, right? 6% of men experience PTSD in their lifetime. Typically, it will last them about a year. We have 12% women that suffer with it in their lifetime. Of course, we see the women are higher, right? I don't think we're too shocked about that either, right? And they typically suffer for up to 4 years, right? Now, PTSD for each person is going to be different. Some people it can last weeks, some people months, some people years, right? Men's top reasons for suffering with PTSD is, sexual assault and abuse, combat exposure, childhood neglect, also childhood physical abuse. With women, theirs is from, of course, sexual assault, physical attack, being threatened with a woman, among other things, right? And when we look at some of the causes of PTSD, we have serious accidents, physical and sexual assault, abuse of including childhood or domestic abuse, exposure to traumatic events, abuse including remote exposure, serious health problems, childbirth experience, of course, the loss of a child, death of someone close to you, war and conflict, torture, among other things, right? And 1 in 3 people experience severe trauma. It's not fully understood why some people develop the condition while others do not, okay? So not everybody that has a trauma goes through PTSD, but that is a part of, what some people go through. And so, of course, we have different types of PTSD. So normal stress response, right, is what occurs before PTSD begins. Acute stress disorder usually comes from seeing natural disasters, right? Or loss of loved ones. Uncomplicated PTSD is when a major traumatic event happens. Complex PTSD is when multiple traumatic events happen, right? And comorbid PTSD is when more than one mental concern or co-occurring disorders and substance abuse issues are going on, right? And so stages of PTSD: one, impact of emergency stage, right? Two, denial numbing stage. Three, rescue stage, including intrusive or repetitive stage, right? And four, short-term reconstructive or recovering stage, you guys. And of course, like with anything else, we have different symptoms, right? But most people probably would expect the psychological symptoms, but may be surprised to learn that there's physical symptoms. So you guys always hear me talk about, how when you're mentally sick, you can become physically sick. And when you're physically sick, you can become mentally sick. They do go hand in hand. And so there are some physical symptoms as well when you suffer with PTSD, such as getting heartburn, diarrhea, stomach aches, weight loss, migraines, chronic pain, muscle cramps, and lower back pain. And you guys, if you're not familiar with it, a lot of people that suffer with depression do usually have chronic pain and lower back pain and things like that. So, like I said, goes one hand in hand. You got to pay attention to both. Now, of course, there are a lot of psychological symptoms as well. One being, depression, anxiety, hopelessness, distrust, right? And then two, avoidance, avoiding activities you once enjoyed, avoiding people or places, trying to avoid thinking about the traumatic event that you went through. You can have emotional numbness. You can feel detached from others. You can have reoccurring nightmares or flashbacks. You know what I'm saying? You can have unwillingness to discuss the trauma, difficulty sleeping, insomnia, right? Trouble concentrating. You can be easily frightened, have fear, have phobias, have panic attacks. You can be on guard at all times. You can have mood swings, okay? Sometimes aggressive behavior. You can have this intense guilt or shame, self-blame. You can have self-destructive behavior. You can be using drugs and alcohol to try to cope, and you can have suicidal ideations. And so, guys, unfortunately, there is no cure for PTSD, all right? But the symptoms can be treated with group therapy, psychotherapy, cognitive behavior therapy, and eye movement disindentation reprocessing therapy, also known as EDMR, right? And of course, there is, if need be, medications and, just sometimes talking to people and doing self-care and things of that nature before it gets to, those other stages and gets to you needing to even go in to see a therapist, depending on what your situation is, because everybody's is going to be different, can be a big help to you too. So you will have to see which one fits, your situation, or maybe your loved ones, your friend's situation, if you or anybody have ever experienced this, okay? And so the next thing that I just want to share with you guys is trauma permanently changes us, right? This is the big scary truth about trauma. There's no such thing as getting over it, right? The 5 stages of grief model basically marks this universal stage in learning to accept loss. But the reality is, in fact, much bigger. A major life disruption leaves a new normal in its wake, right? There's no back to the old me. You are different now, full stop. And this really resonated with me. It stuck out to me because when I first got injured on the job years ago and hurt my back and leg, I would say over and over, I got to get back to the old me. I can't wait to be the old me, right? I think that this fits whether we are talking about loss, whether we are talking about trauma, whether we are talking about being physically sick. You could put it to any of those situations, right? Sometimes you're not going to be the old you. Sometimes you're not going to get back. And I remember the first time that my counselor was like, well, what if you're not supposed to go back to that old you? What if you're never going to get back there? Then what? You know what I mean? What's happening with the new you that you're supposed to be? And so this does not have to be a negative thing, guys. Healing from trauma can also mean finding a new strength and joy, right? And I know it's hard for us when it comes to change, right? And nobody likes changes a lot of times, right? And so the goal in healing is not just, papering over or glossing over the changes in an effort to preserve or to present things as normal. It is also, knowledge and where your new life, right? The warts, the pains, the bruises, whatever, and the wisdoms and courage and all, right? Just accepting everything, totally, or whatever the case may be. And so it's a process, but it's not impossible. It is something that we can do, all right? So now I want to leave y'all with my positive affirmation for today, and that is life is. Life is a challenge, meet it. It's a gift, accept it. It's an adventure, dare it. It's a sorrow, overcome it. It's a tragedy, face it. It's a duty, perform it. It's a game, play it. It's a mystery, unfold it. It's a song, sing it. It's an opportunity, take it. It's a journey, complete it. It's a promise, fulfill it. It's a beauty, praise it. It's a struggle, fight it. Okay, so that's what I got for y'all today, all right? We are going to continue spreading awareness and, stopping the stigma and educating each other and sharing with each other and hopefully uplifting each other. That is what it is all about. And I will see you guys next Saturday. Have a great day, a great weekend. If today is not a good day, I hope tomorrow is a better one. All right. May you be blessed and take care of yourselves. Till next time. Toodaloo.